Welcome back, everybody, to another deep dive. This time we're going deep on health history taking, something I know is super important for nursing students and faculty, so I'm glad you all are here.
Absolutely. It's such a fundamental part of providing quality care.
Yeah, for sure, and we've got a ton of resources on gathering patient information, but we want to really boil it down to the essentials.
Exactly. Cut through the clutter and highlight what really matters.
Okay, perfect. So let's jump right in. Our sources emphasize these two main types of assessments, comprehensive and focused. How do we decide which one's right for the situation?
Well, a comprehensive assessment is, like you said, a deep dive. It gives you that holistic view of the patient's health. It's really ideal when you're seeing a patient for the first time.
So it's about establishing that baseline, right?
Exactly. You're getting the full picture.
Gotcha. But then sometimes you need to be a bit more targeted.
Right. A focused assessment is more appropriate when you're dealing with a specific issue. Like a patient comes in with a cough, you're going to zero in on their respiratory system.
So it's all about efficiency, especially in urgent care or routine checkups.
Exactly. You're focusing on what's most relevant at that moment.
But even with a focused assessment, we're still keeping an eye out for those connections to the bigger picture, right?
Absolutely. You're always looking for clues that might suggest something else is going on.
Makes sense. So, okay, whether it's comprehensive or focused, we're gathering both subjective and objective data.
Right. And that distinction is so important for organizing information and communicating clearly with the rest of the healthcare team.
Totally. So subjective data is what the patient tells us, right? Their symptoms, feelings, concerns, all that.
Yeah, it's their experience in their own words.
So if they say, I have a pounding headache, that's subjective.
Exactly. But if you as the clinician notice their pupils are dilated, that's objective data. It's based on your observation and measurement.
Okay, that makes sense.
Yeah.
So objective data is more about those measurable findings.
Mm-hmm.
Right, let's say we're doing a comprehensive health history. What are the must-have components we need to cover?
Well, think of it like building a story. You start with the basics, date, time, patient identifiers, and importantly, who's providing this information? Is it the patient a family member? Or are we pulling from medical records?
That helps determine the reliability of the information, right?
Exactly. Then we move on to the chief complaint, the reason the patient is seeking care. And here, it's so crucial to capture their own words.
Like if they say, my stomach feels like it's doing somersaults, write that down verbatim.
Precisely. It's much more descriptive than just saying abdominal pain.
So we're painting a vivid picture with their words.
Exactly. And then we delve deeper into the history of present illness. This is where we really explore the patient's experience.
Okay, so we're asking those clarifying questions about when it started, what makes it better or worse, all those details.
Well, we want to understand the full context of their symptoms. One helpful approach is using old CARTs.
Oh, I love a good acronym. What does that stand for?
Onset, location, duration, character aggravating and alleviating factors, radiation timing and setting.
Wow, that's comprehensive. I'm writing that down.
It helps you remember all the key questions to ask and ensures you're getting a complete picture.
So we're basically playing detective, right?
Exactly. You're looking for clues and patterns that will help you understand what's going on.
Love it. And as we're gathering this information, we're also considering pertinent positives and negatives, right?
Exactly. Those are so important. Pertinent positives are symptoms that support a particular diagnosis, while pertinent negatives help us rule out certain conditions.
So it's about strengthening our suspicions and narrowing down the possibilities.
Absolutely. And of course, we can't forget about past medical history.
Right, so we're looking at their childhood illnesses, adult illnesses, any surgeries or hospitalizations they've had.
Exactly, anything that might provide context for their current situation.
Like flipping through their medical chapters, seeing what's led them to this point.
And we also want to know about their health maintenance practices. Are they up to date on vaccines and screenings?
Right, so it's a chance to identify any gaps in care.
Exactly. Then we move on to family history, which can reveal potential genetic predispositions.
It's like mapping out their family tree, but instead of names and dates, we're looking for patterns of illness.
Yeah, things like heart disease, diabetes, cancer, anything that might run in the family.
And family history is not just about genetics, right? It also tells us about shared environments and lifestyle choices.
Exactly. If multiple family members have lung cancer, but only one was a smoker, it suggests there might be other factors involved.
Okay, so we're looking for those environmental or behavioral clues as well. And then we come to the personal and social history. This is where we really get to know the person behind the patient, right?
Exactly. We want to understand their relationships, their work, their habits, their beliefs, all the things that shape their overall well-being.
It's about seeing them as a whole person, not just a collection of symptoms.
And don't be afraid to delve into sensitive topics. Alcohol, tobacco, drug use, sexual history, these are all important aspects of their health.
It's about creating that safe and non-judgmental space for them to open up.
Exactly, and using inclusive language, asking about their sexual orientation and gender identity, respecting their pronouns.
So we're being mindful and respectful in our approach.
It's crucial for building trust and rapport.
Okay, what about social support? That seems like a big one.
Absolutely. Do they have close friends or family they can rely on?
Social connections play a huge role in health outcomes.
So we're not just focusing on the physical, but also on the emotional and social aspects of their health.
Exactly. And of course, we want to know about their lifestyle habits, exercise, nutrition, safety measures. Even their spirituality can be relevant.
It's about understanding the full picture of their life and how it influences their health.
Exactly. And gathering all these details helps us provide the most individualized and effective care.
So we've covered a lot of ground. Is there anything else we need to consider for a comprehensive health history?
One last key component, the review of systems. It's a systematic way to make sure we haven't missed anything.
Okay, so it's like our final sweep for any lingering symptoms. Yeah, you're essentially doing a head-to-toe check, asking yes or no questions about different body systems.
This could uncover things that the patient didn't even think to mention or didn't connect to their main concern.
Exactly. It's about prompting their memory and ensuring we have a truly complete picture.
So we're leaving no stone unturned, right?
Exactly. And any significant symptoms we discover during this review should be moved up to the history of present illness section in our documentation.
So it's all about organization and presenting a clear and concise story for other healthcare providers.
Absolutely. It's about ensuring everyone is on the same page.
Makes sense. So we've covered the essential components of a comprehensive health history. Now, how do we take all this knowledge and apply it in real-world settings?
That's a great question, because things can look very different depending on where you are.
I imagine gathering information in a busy ER is a whole different ball game than a relaxed clinic setting.
You're absolutely right. Let's dive into some of those specific scenarios next.
Sounds good. I'm ready for round 2.
Okay, let's do it. So, yeah, like you said, different settings really demand different approaches to that health history.
Totally. Like, picture this. You're in a packed ER, and a patient comes in complaining of chest pain. What are your priorities in those first few minutes?
Well, first and foremost, we have got to make sure they're stable, right? Rule out anything life-threatening.
Right. So while the team's getting them on oxygen and monitoring vitals, you're already starting to gather info.
Yeah, but it's targeted information. We don't have time for a full deep dive at that point.
So we're focusing on like onset, location, severity of the pain, any other symptoms they have, and pertinent medical history, of course.
Exactly. Anything that could point to a heart attack or other serious issues.
And you might not always get the most clear or coherent history from the patient themselves, right?
Right. They could be in pain or confused. So we might have to rely on family members or paramedics for info.
It's like solving a puzzle, but with missing pieces and a time limit.
Exactly. High-pressure situations for sure.
Yeah.
So the ER is all about speed and efficiency. Now imagine you're in the ICU.
Okay, so now we're dealing with patients who are often critically ill and maybe can't communicate at all.
Right. In those cases, we have to rely heavily on family members, medical records, other healthcare providers.
But piecing together a story from fragments.
Exactly. And even if the patient can't speak, we're still observing, advocating for them, looking for any signs of pain or discomfort.
So we're still gathering data, just in
Yeah.
different ways. And I imagine there are a lot of sensitive conversations happening in the ICU as well.
Absolutely. Discussions about end-of-life wishes, difficult prognosis, those can be tough, but they're so important.
It takes a lot of empathy and a strong ethical compass to navigate those situations.
For sure. Okay, so we've talked about the ER and the ICU. Now let's switch gears to the nursing home.
Right, so now we're working with residents who might have a whole different set of needs and challenges.
Right. We might be dealing with cognitive impairments, functional limitations, things that make communication more complex.
So dementia, hearing loss, mobility issues, all things that could affect our approach to the health history.
Exactly. We need to be patient, flexible, adapt our questions, use nonverbal cues, break the interview into smaller chunks if needed.
And we might also need to rely on family members, caregivers, nursing home staff for more info.
Definitely. And in this setting, it's not just about medical history, but also about assessing their functional status.
So like their ability to do everyday things like bathing, dressing, eating, all those ADLs and IEDLs.
Exactly. That's crucial for developing their care plan.
Makes sense. So we're really taking their environment and support system into account.
Absolutely. Okay, last stop on our tour of settings home healthcare.
Now we're literally stepping into the patient's world, seeing them in their own environment.
And that can be so valuable. You get a whole different perspective on their life and support system.
You can see firsthand how they're managing things at home, how their environment might be affecting their health.
Right. We can assess for safety hazards, observe how they're handling medications, get a better sense of their overall well-being.
It's like getting those missing puzzle pieces that we wouldn't see in a clinical setting.
Exactly. You might uncover financial struggles, social isolation, even signs of elder abuse.
So it's about being observant, using all our senses to gather those important details.
Exactly. So whether we're in the ER, the ICU, a nursing home, or someone's living room, the key is adaptability.
Right, meeting the patient where they are and tailoring our approach to their unique needs.
And always remembering to center their well-being in everything we do.
That's a great takeaway. So we've seen how these fundamental principles of health history taking can be applied in so many different ways.
Exactly. And as you gain experience, you'll develop your own style. But never forget the importance of that patient-centered approach.
It's all about understanding the person behind the symptoms.
Right, and using that understanding to guide their care.
Okay, so we've covered different settings. Now I want to dive into some real-world scenarios, like specific cases.
Perfect. Let's bring those principles to life.
All right, hit me with your best case study. Okay, so we've talked about all the components of a good health history and how to adapt our approach in different settings, but I want to see it in action. Bring these principles to life.
Absolutely. Let's do it. Let's start with a case that really highlights the importance of being thorough and picking up on those subtle clues that patients might not even think are important. So picture this. We're in an ambulatory care clinic, and a 30-year-old woman comes in complaining of fatigue.
Okay, fatigue. It's so common, but it could be a sign of so many things. Where do we even begin?
Right, we start by digging deeper, How long has she been feeling this way? When did it start? How severe is it? Is it constant or does it come and go?
So we're getting the specifics to really understand her experience.
Exactly. And then we explore any associated symptoms. Has she noticed changes in her sleep or appetite, weight changes, maybe mood changes? Has she been feeling more anxious or depressed?
Okay, so we're looking for those connections, those patterns that might point us in the right direction.
Absolutely. And of course, we want to review her past medical history, any chronic conditions, recent illnesses, surgeries, medication she's taking. It all helps us connect the dots.
It's like we're piecing together a puzzle, right?
Exactly. Now, let's say during the review of systems, she mentions, almost casually, that she's also been experiencing some hair loss.
Hair loss could be a small detail, could be significant. How do we approach that?
Right. We don't want to dismiss it because hair loss combined with fatigue could point to a thyroid disorder, an autoimmune condition, or even a nutritional deficiency.
So by being thorough and paying attention to those seemingly minor symptoms, we might uncover something really important.
Exactly. It's a reminder that every detail matters. Okay, let's shift gears to a more acute setting, the emergency department. A 65-year-old man arrives by ambulance struggling to breathe.
Okay, now we're talking time-critical decisions. We need to assess his respiratory status fast and rule out anything life-threatening.
Right, so while the team's getting him on oxygen, monitoring his vitals, we're gathering that crucial info. When did this shortness of breath start? How bad is it? Anything make it better or worse?
And looking for any accompanying symptoms, too. Chest pain, coughing fever, anything that could give us more clues.
Exactly. And in this scenario, his past medical history is essential. Does he have a history of heart failure, asthma, COPD, recent surgeries, long flights, anything that could increase his risk for a blood clot?
And he might be too breathless to answer all our questions, so we might need to get info from family or paramedics.
Right, we gotta be resourceful. Now, let's say we find out he has a history of heart failure and he recently stopped taking his medications.
Now we're starting to see a possible explanation.
Exactly. By connecting his symptoms, his history, his recent actions, we can start forming that working diagnosis and get him the right treatment.
It shows how important a good health history is, especially in those high-stakes situations. Okay, last case. Let's say we're visiting a patient at home who's recovering from a hip fracture.
Okay, so now we're in that home healthcare setting, and our focus is a bit broader.
Right. It's not just about the injury itself, but about how they're managing at home.
Exactly. We're assessing their mobility, their pain level, how well they're able to do those everyday tasks, bathing, dressing, eating.
So we're looking at their functional status in their own environment.
Right, and we're also observing the home itself. Are there any fall hazards? Can they easily get to the bathroom, the kitchen? Do they have enough support to meet their needs?
So it's really a holistic assessment, taking everything into account.
Exactly. It's about recognizing that health and well-being are about so much more than just the physical.
I love these examples. It really brings everything together and shows how dynamic health history taking can be.
Absolutely. As you gain experience, you'll develop your own approach. But always remember that a good health history is about understanding the whole person.
It's about seeing the person behind the symptoms and using that understanding to guide their care.
And that's what leads to the best possible outcomes for our patients.
Couldn't have said it better myself.
Yeah.
Well, I think that wraps up another fantastic deep dive.
I agree. It's been a pleasure.
To all our listeners out there, keep asking those questions, keep learning, and keep advocating for your patients. Thanks for joining us.